Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 31st, 2025. This video is on two Lancet articles. One is the original article titled Sultiame Once Per Day in Obstructive Sleep Apnea, a multicenter randomized double-blind placebo-controlled dose-finding phase 2 trial. And the second is an accompanying commentary or an editorial titled Drug Therapy for Obstructive Sleep Apnea, Promises and Challenges. This was a phase 2 trial which evaluated Sultiame, a carbonic anhydrase inhibitor, versus placebo in obstructive sleep apnea. It was a multicenter randomized double-blind placebo-controlled dose-finding study, 28 centers across 5 European countries, adults aged 18 to 75 years, untreated moderate severe obstructive sleep apnea, AHI equal to or greater than 15 to less than 50 per hour. That's the apnea-hypopnea index. 298 individuals were enrolled, 75 on placebo. Sultiame 100 milligrams, 74 individuals. On higher dose 200 milligrams, 74 individuals. And on 300 milligrams, 75 individuals. Follow-up was 15 weeks treatment. Analysis ANCOVA. Primary outcome relative change in AHI-3A. And secondary outcome AHI-4, oxygenation, arousal index, and Epworth sleepiness scale. What did they find? AHI-3A reduction dose dependent versus placebo with 100 milligrams, 16.4% reduction, p-value 0.032. With 200 milligrams, nearly double, 30.2%, p-value less than 0.0001. At 300, it was 34.6, p-value also less than 0.0001. So kind of plateaued off between 200 and 300 milligrams. Absolute reduction up to about 10 events per hour, improved oxygen saturation, reduced arousals, improved Epworth sleepiness scale in the sleepy subgroup. Adverse events related mainly paraesthesia, 57% versus 9%. Key takeaway, first large randomized controlled trial showing pharmacologic benefit in obstructive sleep apnea. 200 milligrams shows best benefit risk profile. Promising non-CPAP option, merits a phase 3 study. The accompanying editorial talks about the burden of obstructive sleep apnea affects 1 billion people. CPAP is first line, but long-term adherence is challenging. Tirzepatide is also a 20% weight loss, a 55% reduction in apnea-hypopnea index, FDA approved for obesity-associated obstructive sleep apnea. Atomoxetine plus eroxabutanine, 30 to 50% reduction in apnea-hypopnea index. But there's an increase in heart rate, and phase 3 is ongoing. This carbonic anhydrase inhibitors, acetazolamide and Sultiame, 30 to 40% reduction in apnea-hypopnea index via an increased respiratory drive and an increased airway tone. In the flow trial, 298 individuals, Sultiame 200 milligrams optimized for benefit risk, symptom gains in sleepy subgroup. This implicational study, according to this editorial, moved towards a personalized endotype-based pharmacotherapy, combo strategies likely. In my opinion, this may be useful in the non-obese sleep apnea OSA patients. Clinical pearls. Sultiame inhibits carbonic anhydrase, improves muscle airway tone. Potential alternative therapy for those intolerant to CPAP. Check for paraesthesia, monitor tolerance. Effects greater in symptomatic sleepy patients. Drug strategy aligns with precision sleep medicine. The Epworth sleepiness scale was created by Murray W. Johns, MD, in 1990 while he was working at the Epworth Hospital Sleep Centre in Melbourne, Australia. Sultiame historically was used in benign childhood epilepsy. This slide describes the difference between AHI-3A and AHI-4. Hit pause to read details. Typically, AHI-3A tends to diagnose more obstructive sleep apnea and aligns better with symptoms of sleep fragmentation. AHI-4 yields lower event counts and can undercall disease in patients with sympathetic arousal but smaller desaturations. Example, younger patients, women, and athletes. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.